Today we will be talking about the blood test of AMH or anti-Mullerian hormone. In females, ovary produces the egg and the ovary have a very important role in the fertility system of the females. Ovary can produce a limited number of eggs in the human females and it is predetermined in the fetal age or in the gestational age of that particular female. They are born with a limited number of eggs and that decreases as the age advances. Usually, the female have the maximum fertility potential in the age of 18 to 30 years and then it progressively declines, which the rate of declining increases much rapidly after 35 years of age. After 40 years, most of the women have irregular menstrual cycles and after 45 years, a menopause can ensue in 50 to 60% of the women, which increases to up to 90% by the time they reach 50 years of age. In Indian females, it has been seen that after 35 years of age, there has been a more rapid decline in the fertility potential of the woman and hence ovarian reserve needs to be checked for all the women who are trying fertility and who are not able to conceive naturally. Now let's talk about AMH. AMH is full form is anti-Mullerian hormone. It is being produced by the small follicles of the ovary. It represents the number of the follicles present in the ovary or the eggs which are available for the future fertility of the woman. It is usually in the levels of 2 to 4 nanogram per ml. If it is very low or if it is very high, both can have an effect on the fertility. If it is very low, it usually indicates that the women are either of the advanced age or they have a very decreased potential for fertility. These women are recommended to go for an accelerated treatment to conceive as fast as possible. And if they have not been able to conceive with the natural methods, they are taken up for the in vitro fertilization and they are recommended to use recombinant gonadotropin hormones for the further maximizing their fertility potential. Women who have very high AMH are usually considered as a diagnosis of polycystic ovarian disease and therefore are also at a high risk of developing ovarian hyperstimulation with both the ovulation induction as well as the IVF treatment. So these women usually produce small number of cysts and are not able to produce a mature egg and hence can have fertility problems. AMH is a very important marker for ovarian reserve and is need to be assessed in most of the individuals who are trying for pregnancy and in all the individuals who are suggested IVF treatment. It not only tells us about the ovarian reserve, it also indicates about the response of the IVF treatment and hence in prognostication of the female as well as the couple. It is a very important blood test and it should be done in a proper fertility clinic under a fertility expert and should be interpreted cautiously.